Hi, thank you for watching this video on medical reporting and the DR2401. My name is Terry Cassidy. I'm an occupational therapist and a certified driver rehabilitation specialist. I am also the owner of Fitness to Drive, and myself and my team provide occupational therapy comprehensive driving evaluations at locations across the Front Range. I'm going to start out today with talking about medical reporting in general, and then really some specifics about the form, trying to keep this as succinct as possible for all of you. This handout is available on our website under information for health professionals, and I'm also happy to email it to you. This is the whole form, and we're just going to look at a couple pieces of it. First thing I want to mention is that Colorado is a self-report state, which means that medical providers are encouraged but not required to report unsafe drivers to the DMV. I do want to note that there's no medical review board in Colorado, so you may be the only person on their medical team thinking about driving and sending things in. So I do think it's a really important topic to be on everyone's radar. And we'll talk about this a little more in the instructions, but it must be signed. The form must be signed by an MD, OD, or PA. The liability protection piece is written on the form, but I have this highlighted here. The important thing to note here is it's really covers a physician or a physician assistant, not an occupational therapist, not a neuropsychologist or caseworker, case manager, social worker. So that is part of the reason why these forms are routed through the physician's office. And then to find this form, this bottom box, you would always get the most current version of the form on the colorado.gov/DMV website. Knowing the number of the form is super helpful. So the form is now 6 pages. Some of you may remember it used to be 2 pages, front and back. It's the same information. They've just made it longer, basically. So it comes with an instruction sheet, and there are a couple pieces that I want to point out on here. I will then go through sections of the form and talk to you about how those impact what happens with the patient after you fill out that form. So the first section should be completed by the driver. Oftentimes, if we're doing this in our office, we are filling in their information and sending it on to you. And just to back up for a second, this form may be something that you see after you refer someone for a driving evaluation. We are always sending this form back with our report, whether the result is that the person passed, or that there are recommendations, or that cessation is recommended. We use it as a medical clearance to drive form, as well as a reporting form if there are issues. You may also see this form because a client brings it to you. There's a variety of reasons why that could happen, or you're pulling it up on your own because you have concerns. So, number 2, under this first section, the driver/patient should sign this section. Yes, but it is not required. And that is clearly stated on the form, but just good for everyone to know. Kind of the piece here that I want to talk about next is who can sign the form. It is an MD or DO, PA, and then there's a separate vision form, and they use the same instruction sheet. That could be ophthalmology or optometry. You'll notice that nurse practitioner is not on this list. This is not a judgment in any way. This is an old Colorado statute, and that's what these forms are based on. So in order to change that, which I highly support, there would need to be a change. There would need to be a lobbying to the Colorado government to change that form. So I would love to support that if anyone wants to make that happen. But in the meantime, this is what we have. The form is valid for 6 months, so you need to have seen the client within 6 months of signing this form. And we'll talk about that in the form. And then this part, DMV retesting in 1 year, this really, I think, is often clicked, thinking it means just the client needs to come back and see the doctor in a year. Potentially, they ought to come back and see the OT for a driving evaluation in 1 year. But this really, if this section is marked, it will trigger a re-evaluation. And I'll talk about that in a minute. Let me move on to the form. So this is that first section, patient information as much as possible here. driver signature not required. So just pointing that out. Then the next page is the physician section. This does have the liability piece in here, the protection basically. And then this examination date section is required. So a lot of the things that I'm pointing out today are because we see these forms a lot. We get the DMV calling us because the form was filled out incorrectly. So trying to help this whole process go more smoothly by trying to communicate with the people who are filling out the forms in the first place. And then also sometimes these forms are filled out in a way that causes more barriers for the client to have a driving evaluation. So that's a big part of what I want to talk about today too. So examination date would be when the patient was seen in your office. It needs to be within 180 days from the day the form is signed. And then this is the question on that same page, required DMV retest in 1 year. If yes is marked here, the client will automatically be mailed a letter in a year saying, please come in for a reevaluation. A reevaluation includes the vision test, the written test, so the knowledge of rules on the road, and then they will need to complete a behind the wheel test, not with us, and the DMV no longer does behind the wheel testing, so they would have to go to a driving school to do that 15-minute drive test. Sometimes that's the case, and that's what is the safest option for this patient, and that might be why that's checked. But I think a lot of times this box is being checked thinking they just need to come back and see the doctor in a year, and that's not what happens with this form. If somebody gets a request for reevaluation, doesn't notice it, doesn't open it, doesn't do anything about it, their license will be canceled within 20 days. So there is a timing piece to here that is important to know. This is the meat of the form, the most important part on here. And I just want to talk about these options a little bit because I don't think it's super clear. The first one, fairly clear, fit to operate a motor vehicle safely. Oftentimes when we do a driving evaluation with somebody, we are sending the report and this form back to you with that box marked. Usually that means they pass the evaluation and they're doing well. There may be recommended license restrictions. See that section down below. So if somebody's learning to drive with hand controls, for example, fit to operate a motor vehicle safely will be checked, and then also the hand control section, and that can be added to somebody's license. Or we frequently see with people with cognitive decline where we're recommending no night driving and no highway driving, and this is where that would come in. The second box on the left, fit to operate a motor vehicle safely contingent upon passing a DMV road test, is sometimes feels like an appealing option. And I just want to talk a little bit more about that. Sometimes it is. If it's a client, a patient who you feel like they're fit to drive, but there's some lingering question or there's some reason you want them to go through and do, again, it triggers a reevaluation. So it's going to be the vision test, the written test, and then an on-road test with a driving school, which is the basic operator skills test. So if that's what you're intending, mark this box. I do think that sometimes this box is marked when people want them to come for a full occupational therapy driving evaluation. The downside, or the reason that doesn't work out so well sometimes, is that if this box is marked, the person will get that same come in for a reevaluation letter. And again, if they don't do anything about it, maybe they have memory issues, maybe they don't check their mail, maybe they've moved, their license will be canceled. We cannot do a drive test unless somebody has a valid license or permit or rehab permit. And so if somebody's license has been canceled prior to them coming for the evaluation, we can do the in-clinic portion, but we can't do anything behind the wheel. So this leads me to the next one that sometimes we see, and I think sometimes it's clicked in error or just prematurely, would be not fit. So again, there's a lot of situations where this is the appropriate choice. This person is not fit to drive. They don't need to go back and do the testing. It has just been decided by the medical team that driving cessation is what should happen. In this case, mark the box that says not fit to operate a motor vehicle safely. That will go into the DMV and cancel that person's license. They'll get a letter in the mail letting them know their license was canceled, and they can come in and trade in their driver's license for an identification card. Again, if you're intending for this person to come to an occupational therapy driving evaluation, even if you don't expect them to pass, please don't send this form into the DMV with not fit to drive until after the evaluation. Same result. If the patient's license is canceled before we see them, we cannot complete the full evaluation. So what happens when that happens? Because this happens at least every couple of months, somebody comes to us on the recommendation of their doctor, but they no longer have a valid license. What that looks like on our end is we will do the first part, the in-clinic part of the evaluation, and then start the paperwork for the rehabilitation permit. So the box that I haven't talked about yet here, fitness to drive determination pending. A rehabilitation permit is a special category of driver's permit that only allows that person to drive with a driver rehab professional license through the state. So any of the Colorado CDRS providers are pretty much the only people that are on that list. And so a rehabilitation permit can be appropriate, again, if someone's needing to learn to drive with equipment or you're concerned that they're gonna go off and try driving on their own. This is an option to make sure that they're only driving for the driving evaluation. Just know that there is some extra paperwork with that. So this DR2401 form will need to be filled out to initiate the rehab permit. And then after we see them, there'll need to be another form filled out and another trip to the DMV for your patient. Hopefully that's making sense. Certainly open to any questions. I just want to get this information out there. I have a couple more slides. This one is really just emphasizing what is required. So basically any of these, the specialty, license number, phone number, are required sections. If we get this form and see that these aren't there, we'll send it back, trying to make the process go more smoothly on the DMV side. Okay, conclusion. If you're referring a patient for an OT CDRS evaluation, I would appreciate it if you could not fill out the 2401 until we have seen them. I recommend that you ask your patient to not drive. If you're having concerns about their driving, tell them, please don't drive until you have this evaluation done. If you don't trust that or you don't feel safe with that, to me, the next best option would be request a rehab permit, and we can go that route with the patient so that they don't have a valid license in that in-between time. So, a couple of resources for you all. This section of our website is basically just for questions, really geared toward professionals. So if you have questions about any of this, of course you can email me, call me, but you can also go on our website and just type something in and I'll respond to you directly. Patients can set up a free consult call through our website just to talk through their specific case. So sometimes people do get a letter in the mail and they want to know who to talk to. They can contact us through our website. And then just a general great resource is the Colorado's Guide for Aging Drivers. We publish these with CDOT funding. It's available for download or we can mail a copy to somebody. Sign up for that through our website as well, and happy to give these by the case to offices as resources for your patients. So thank you so much for paying attention and being here today. My name's Terry, and I hope to be in touch with you all soon. Well, only if you need it. Thanks so much. Bye-bye.